So good day everyone, especially to our dear instructor, Ma'am Riza Francisco. So our group will be reporting about the child and the adolescent health. But before anything else, I will first introduce my group members. So we are the group 2 and I am Hannah Claire P. Eliseo. So my group member, we have here Miss Flores Antoinette. Next is Mr. Galyaza Mark Jacob, to be followed by Miss Gekale Sofia, Harid Atia, Hako Denise, and we also have here Mr. Linao Ian. We have Magdaluya Vinville, Ko Andrea, Malabuyok Nicole, and lastly we have Miss Harid Cassandra. So basically, child and adolescent health is very important. Since we are student nurse, health is our priority. So here in our report, we will be tackling about the different risk factors, different health management, and we have here our 6 key components. So here our key components. So first is we will be discussing about the preventive health care. So under here is the regular well child visits for immunizations, the importance of immunizations, and also developmental screenings and early detection of health issues. We will also discussing here about the adolescent health services that address physical changes, mental health, and risky behaviors. And then second components is the nutrition and physical activity. So nutrition and physical activity is very important in child and adolescents. This is very crucial in maintaining our health condition, our good health condition. So here we will also be tackled about the overall development of the child and adolescents in terms of physical changes, mental health, and risky behaviors, and what are the effect of nutrition and our health. We also have here, or we will also be discussing about the mental health. So in mental health, specifically in adolescents, so we will be discussing here the early identification and treatment of mental health issues, including depression, anxiety, and behavioral disorders. We will be also discussing about the support for adolescents dealing with stress, substance abuse, and issues related to identify and self-esteem. And also, our fourth key components is the reproductive health, especially in adolescents also. So under here is the education on reproductive health, specifically the sexually transmitted infection and contraceptives options to avoid early pregnancy. We also tackled here is the support for pregnant and parenting adolescents to ensure their health and health of their offsprings. Next, our fifth key components is the injury and violence prevention. So under here, we will be discussing about the strategies to prevent injuries, both accidental, such as from traffic accidents, and intentional, such as from bullying or violence. Under also here is the programs to address the root causes of violence and support affected children and adolescents. So lastly in our key components, we will be discussing about the chronic conditions management. So under here, we will be discussing about the care and support for children and adolescents with chronic conditions such as asthma, diabetes, and special healthcare needs. And then we will be discussing also about the coordination of care across multiple healthcare providers and services. So that's our topic all about. So we will now proceed for
Challenges in child and adolescent health. First is access to care. Ensuring all children and adolescents have access to comprehensive healthcare services regardless of socioeconomic status or geographical location. Limited availability of healthcare services, particularly in rural or underserved areas, restricts children and adolescents from receiving adequate medical attention. Second is mental health stigma. Overcoming stigma associated with mental health issues to ensure adolescents seek and receive the help they need. Persistent societal stigma discourages young people from seeking help for psychological issues like anxiety or depression, worsening mental health outcomes. Third is health disparities. Addressing disparities in health outcomes related to race, ethnicity, socioeconomic status, and other factors. Socioeconomic inequalities lead to uneven health outcomes, with marginalized groups often experiencing higher rates of illness and reduced access to preventive care. Fourth is environmental risk. Mitigating the impact of environmental factors such as pollution and climate change on children's health. Pollution, climate change, and unsafe living conditions expose young individuals to physical health risks and developmental challenges. Fifth is digital age challenges. Navigating the impacts of screen time, social media, and cyberbullying on mental and physical health. Excessive screen time, cyberbullying, and exposure to harmful online content contribute to physical, emotional, and societal difficulties for children and adolescents. Next is strategies for IMCI and adolescent health. First is integrated care. Developing integrated care models that address the full range of health needs from physical to psychological within a coordinated framework. Second is family and community engagement. Involving families and communities in health promotion activities to create supportive environments for children and adolescents. Next is policy and advocacy. Advocating for policies that protect and promote child and adolescent health, including access to care, environmental health, and education. Fourth is education and awareness. Implementing programs that educate children, adolescents, and their caregivers about health issues, preventive measures, and healthy lifestyles. Next is research and innovation. Encouraging research into child and adolescent health issues to inform evidence-based practice and innovative solutions.
Good day everyone! Today I will discussing the growth and development milestone from birth to 5 years old. First is about physical development. Between 1 and 2 years, they can walk independently, making a significant step in their physical independence. As they grow stronger, they begin to run, although their steps may still be unsteady. They can climb stairs with assistance and start to interact with objects like spoons during feeding. By 2 to 3 years, a child's physical ability becomes more stronger. They run more confidently and with better balance, and they climb well and even start use larger play equipment. And also they can ride a bicycle, which is improved leg strength and coordinations. And also they use utensils better during meal time. From 3 to 5 years old, children can run, jump, and even begin to skip, which is showcasing more complex movement. And their fine motor skills improve significantly, allowing them to engage in the tasks like drawing, coloring, and dressing themselves, which is they show a growing interest in physical play and can participate more actively in group activities. In summary, physical development from birth to 5 years involve progressive milestones that showcasing increasing mobility, coordinations, and independency. Understanding these milestones is very important for assessing a child's growth and providing appropriate support to promote their development. Next is about cognitive development. In the first year of life, cognitive development is closely to sensory exploration, which babies primarily explore the surroundings through the sense such as touching, tasting, seeing, and hearing. And also they begin to understand the cause and effect, and also the infant show curiosity about the objectives, often reaching for and manipulating them to learn about their priorities. By 2 to 3 years, cognitive skill continue to develop and memory becomes more evident. Children can follow simple commands such as pick up the ball, and they start to sort objects by shape and color, demonstrating an understanding of categories and basic concepts. Memory improves and they begin to recall recent events such as remembering where they left a toy. From 3 to 5 years, cognitive ability become more advanced and curiosity about the world. They develop a greater attention span, allowing them to focus on activities for longer periods. Children become to understand time concepts such as yesterday and tomorrow, helping them make sense of past and future events. They often ask about question the world and reflecting their desire to learn and understand their surroundings. In summary, cognitive development from birth to 5 years involve a progressions from sensory exploration to more complex problem solving, memory, and understanding of the world. Recognizing this milestone is very important for fostering a child intellectual growth.
Language development. Birth to 1 year makes cooing and bubbling sounds and starts to say simple words like mama and dada and responds to their name. 1 to 2 years old. Vocabulary expands rapidly, starts to form simple sentences, and follows simple instructions. 2 to 3 years old. Use sentence with 2 to 4 words. Vocabulary grows to about 200 words and begins asking questions. 3 to 5 years. Speaks in more complex sentences, understands preposition in, on, or under, and can tell simple stories. Emotional development. Birth to 1 year. Smiles, shows preferences for certain people and toys, and may experience stranger anxiety. 1 to 2 years. Shows a wide range of emotions and may have a temper tantrums and begins to show signs of empathy. 2 to 3 years old. Plays alongside other children, parallel play, starts to share with guidance and show independence. 3 to 5 years. Engage in cooperative play, can take turns, shows more awareness of other people's feelings, and develop friendships.
The immunization program in the Philippines. The immunization program in the Philippines is a critical component of the country's public health efforts aimed at reducing the incidence of vaccine-preventable diseases among Filipinos, especially in children. Administered by the Department of Health, or DOH, the program follows the guidelines set by the World Health Organization, or WHO, and includes a schedule of vaccinations provided at no cost to the beneficiaries, primarily targeting infants, children, pregnant women, and the elderly. So here are the essential vaccines. The BCG, or the Bacillus calmette-guerin for tuberculosis, hepatitis B vaccine given at birth, DPT, diphtheria, pertussis, tetanus, OPV, oral polio vaccine, PV, inactivated poliovirus vaccine, MMR, measles, mumps, rubella, HIV, Haemophilus influenzae type B, rotavirus vaccine, pneumococcal conjugate vaccine, or PCV, human papillomavirus HPV vaccine for adolescents.
Vaccine schedules. Vaccine schedules recommend the ages and intervals at which vaccine should be administered. For example, children receive multiple doses of the top vaccine at 2 months, 4 months, 6 months, 15 to 18 months, and 4 to 6 years. Catch-up immunization. For individuals who miss scheduled vaccines, catch-up immunization ensure they still receive protection. Healthcare providers can provide guidance on catch-up schedules. Preventive care. Preventive care encompasses a range of services aimed at preventing diseases or detecting them early when they are more treatable. This includes routine checkups, screenings, counseling to adopt healthy behavior, and vaccinations. Key aspects include regular health screenings such as blood pressure checks, cancer screenings, example, mammograms and colonoscopies, cholesterol levels, and diabetes screenings. Then we have pediatric care. Well-child visits are essential for monitoring growth and development, discussing nutrition and physical activity, and performing routine immunizations. Then women's health, including pap smears, breast exams, and guidance on reproductive health. Then for men's health, including screenings for prostate health and advice on reducing risk factor of disease. Then for mental health screenings for depression, anxiety, and other mental health conditions.
Herd immunity or community immunity. When a high percentage of the community is immune, it provides more protection for those people who cannot be immunized due to medical condition. The principle is that when enough people in the community are immune, the disease has fewer opportunities to spread. Disease eradication. This refers to the complete and permanent elimination of disease, meaning there would be no new cases in the community or globally. Smallpox is an example of a disease that has been eradicated globally through vaccinations. Cost savings. Preventive care, particularly immunization, is a cost-effective approach to maintaining public health. Quality of life. Preventive care and immunization enhance the quality of life by reducing the impact of disease. This helps people live a healthier life and also lessen the burden of families and the community. The immunization program in the Philippines is a cornerstone of the nation's public health initiative to protect the Filipino people, particularly the vulnerable groups such as the infant, the children, the pregnant women, and the elderly through vaccine-preventable disease. This is initiated by the DOH or the Department of Health in alignment with the global standards of the World Health Organization.
So now let's proceed to the essential vaccination section. The Philippine immunization schedule includes vaccines against a range of diseases. In this slide, there are numerous vaccines included such as BCG, hepatitis B vaccine, DPT, OPV, MMR, HIV, rotavirus vaccine, PCV, HPV, and lastly is IPV. So for the next slide, at birth there are two critical vaccines which are BCG and hepatitis B vaccine. BCG prevents severe forms of tuberculosis like tuberculosis meningitis, whereas hepatitis B vaccine is administered within 24 hours of birth. It protects the newborns from hepatitis B infection. So during infancy, several vaccines are administered. DPT is a combination vaccine protecting against 3 deadly diseases, specifically diphtheria, pertussis, and lastly is tetanus. Diphtheria affects the throat and heart, pertussis causes severe coughing fits, and lastly is tetanus impacts the nervous system. OPV and IPV prevents poliomyelitis, a disease causing paralysis and lifelong disabilities. HIV prevents severe bacterial infections like meningitis, pneumonia, and epiglottitis. PCV shields children from pneumonia, ear infections, and meningitis caused by bacteria. Lastly, the rotavirus vaccine prevents severe diarrhea and dehydration caused by the rotavirus itself, a common illness in infants and young children. As children grow, MMR is given at 9 months and again at later. The vaccine protects against measles, mumps, and rubella. Lastly, adolescents are introduced to additional vaccines such as HPV vaccine.
Challenges and initiatives. Vaccine hesitancy. Following Dengvaxia controversy, the Philippines experienced increased vaccine hesitancy among the population. The government and various health organizations have been working to rebuild trust in vaccines through education and advocacy. Polio and measles outbreak. Recent years have seen outbreaks of diseases such as polio and measles, prompting the DOH to launch emergency vaccination campaigns targeting millions of children across the country. COVID-19 vaccination. The Philippines has also been rolling out COVID-19 vaccines as part of its immunization program, prioritizing healthcare workers, senior citizens, and other high-risk groups. Future direction. The Philippine government continues to expand and adopt its immunization program to address emerging health challenges, improve vaccine coverage, and ensure equitable access to vaccines across the archipelago. Strengthening the cold chain system, enhancing community engagement, and integrating digital tools for better monitoring and reporting are among the strategies being employed to improve the program's effectiveness and reach. Through these efforts, the Philippines aims to achieve higher vaccination rates, reduce burden of vaccine-preventable diseases, and protect health of its population, contributing to the global goal of universal health coverage and improve public health outcomes.
School health programs. School health programs are comprehensive initiatives designed to promote students' physical, mental, and social well-being. These programs are critical because they provide a structured setting in which to address health and safety issues that affect children and adolescents. Effective school health programs can improve health outcomes for students, enhance their learning potential, and establish a foundation for healthy lifestyle choices that can last a lifetime. Key components and benefits of school health programs. Health education, a curriculum that covers a broad range of health topics, including personal health and wellness, nutrition, physical activity, substance abuse prevention, mental health, sexual health education, and disease prevention. The goal is to equip students with the knowledge, attitudes, and skills necessary for healthy decision making. Physical education and physical activity. Programs are designed to promote physical fitness, reduce sedentary behavior, and instill a lifelong physical activity habit. This includes physical education classes and extracurricular sports, recess, and activity breaks. Nutrition, environment, and services, ensuring access to healthy food options at school, including meals and snacks that meet national nutritional guidelines. Nutrition education and promotion are also key to encouraging healthy eating behaviors. For the health services, provision of services to assess, protect, and promote health. This includes screenings, vaccinations, managing chronic conditions, and providing referrals to outside health professionals. Counseling, psychological and social services, support for mental, emotional, and social health. Services may include counseling, crisis intervention, support groups, and addressing issues like bullying and violence. Healthy school environments involve creating a safe physical environment free from hazards, promoting a supportive social environment, and ensuring a climate that fosters learning. This involves policies and practices that encourage respectful and healthy interactions among students and staff. Health promotion for staff, encouraging school staff to pursue a healthy lifestyle that contributes to their well-being and serves as a role model for students. Family and community engagement, involving parents and guardians in health education activities and decisions. Collaboration with community health providers and organizations can also extend the reach and effectiveness of school health programs. School health programs are essential for children and adolescents as they promote overall well-being, which is crucial for academic success and lifelong health. These programs address physical, mental, and social health needs by providing education on nutrition, hygiene, and healthy lifestyles. They also serve as a platform for early detection and management of health issues such as vision problems, mental health challenges, or chronic conditions, ensuring timely intervention. Additionally, school health programs help reduce health disparities by reaching children who might not have access to regular health care, fostering a supportive environment that enhances both health outcomes and learning potential.
So next is addressing childhood obesity and nutrition issues. First is the family and home environment. Encourage families to model healthy eating habits, including consuming fruits, vegetables, whole grains, and lean proteins while limiting sugary drinks and high calorie and low nutrient foods. promote regular physical activities within the family such as walks, bike rides, or sports, and also provide parents with resources and education on nutrition and the importance of physical activity to make informed decisions about their children's health. Next is schools and education. Ensure that schools meal program offer healthy, balanced options that adhere to nutritional standards. Also incorporate comprehensive health and nutrition education into the school curriculum about the importance of healthy eating habits. And also plus physical activity. And also implement quality physical education programs that encourage lifelong physical activity among the students. Next is community and environmental level. Increase access to healthy foods and community, especially in areas concerned considered food deserts through farmers markets, community gardens, and healthy food reviews, and develop and maintain safe community spaces for physical activities such as parks, playgrounds, and sports facilities. And also support policies that promote healthy community environments such as zoning laws for fast food restaurants near schools and subsidies for healthy foods options. Next is the healthcare providers regularly screen for obesity and related health issues in the pediatric visits and provide families with guidance and intervention strategies, and also educate parents and children on the risk of obesity and the benefits of healthy lifestyle. And when necessary, refer families to nutritionists, dietitians, or obesity specialists or specialized care and counseling.